per household. And it's a program where we would set it up front to let people know this is how much, this is what the program looks like, give you an opportunity to opt out of the program if you didn't want to be in the program, and then let it run for the first 90-day period of a complete opt-out period, so a pre-opt-out, and then a 90-day opt-out period. And if you didn't want to opt, and at that point, if you didn't opt out, then you'd be charged moving forward. If at any point during the program you don't want to be in it, you simply opt out. And we would work with your IT department to make that super seamless. In the city of Crandall, what we heard was, we don't want to have to opt out, we want to have to opt in. That's what we heard, and that's what we heard over and over, and you hear that. And so we had to address that. As a city manager, I agreed that we had to put up a program so that we had to make this as simple as possible. So prior to us even launching MD Health, we put banners up across our website to say, opt out of the program now, it's going to start on this date. And so we did about 45 days in advance, and then when it started on that date, we reminded them, your 90-day period, you have a 30-day period, 60-day period if you want to opt out of it. So City of Crandall had about 2,500 utility customers. When I left, there was 1,800 customers still in the program. And you can opt out at any time. And we also, this isn't to take advantage of anyone. So if you don't use it, then we don't want you to have have it. So we'll offer a refund. If we need to, we go back and offer a refund to those who say, I didn't know anything about this, I missed the opt-out. This isn't trying to take advantage of anyone. This program truly works. I was able to run a test drive of it for myself and most of my staff before I left, and it was amazing how great this program works. Simply picked up your phone, you texted a number, within a couple of minutes you get a text back, this is Dr. So-and-so, or this is nurse practitioner so-and-so, or this is a PA. So that's how the group works. They have doctors, nurse practitioners, and PAs. They text you back. In the case I had, my wife had neck surgery. I couldn't scoop her up and take her to the doctor, but she had a really, really bad sore throat. So the doctor said, let me see her throat. Take a picture of it. Open her mouth and take a picture of her tonsils for me. And I texted Tony, he said, good, it's not abscessed. It looks like you just need an antibiotic. Let me call that in for you. What pharmacy do you use? And we're doing all this via text. So this is about 5:30 in the afternoon. By 7 o'clock, I'm at CVS picking up a prescription. I was able to get it to my wife on a Friday, and by Monday she's feeling better. The same thing with
turnaround time from when you text.
A couple of minutes.
A couple of minutes.
And then you'll get a follow-up the next day. How are you doing? Because this man, Dr. Parrott, is a phenomenal guy. He's an ER physician, and he tells the story, and hearing it from him, you can hear the passion in him of how many cases he's seen where he'll be a mom and one kid who's sick, knowing the kid has strep throat, knowing these other two kids are going to get it. They come into an ER. That's not a priority call in an ER, so they'll be in the ER for an hour, hour and a half, 2 hours to address this strep throat. He comes in, sees the child has strep throat, knows that the whole family's going to get it, so he writes a prescription for everybody. He sees them for 4 minutes, 5 minutes maybe, and out he goes. And then he's able to walk past and see them checking out. And this family, well, if you pay now and you pay cash, it'll be $800, or we'll go ahead and bill it to your insurance and let it go through that process. So the best they're going to get out of there is $100 in most cases, maybe $150. And for $9 a month, you could take it. And I'll go through some more on. Let me back up. These are some of the that doesn't want to back up. So who really benefits from this? And so, according to physicians, only about 97% of people that have interactions with doctors really need to see that doctor in person. That doctor could do virtually everything they need to from a distance. Where you have a limited EMS, when in Crandall, we relied on our fire department for EMS, and so they provided paramedic service. And so you'll see a reduction in those calls where they're having to come out and treat somebody at a home or call for an ambulance and let them focus on the bigger things that they have to be focusing on. And of the people, like as I mentioned with the city of Crandall, of the people that signed up, we see about a 70% people that stay in the program, that choose not to opt out. And so it's really designed for those things, to reduce your EMS so you don't have to put a burden on your emergency services. And I don't know Clyde well enough to know. I know there's not a hospital here. Is there a clinic? So some type of a small clinic, and that's where most people, I would think, would go if they couldn't get into a doctor, or they would drive into Abilene. So think about that, the expense of, not only the hassle of loading up your family, who doesn't feel well in the first place, putting them in a car, driving them either to a Hendrick facility or a clinic somewhere, or waiting till Monday or Tuesday to get to see the doctor, and then all to get a prescription. This is what it usually falls into. The other big piece that it does is some people just need refills. Some people are just in a bind between the now and the time they can see their doctor, and maybe they need lisinopril, or maybe they need insulin, or maybe they need whatever kind of a maintenance med they may need. This program can bridge that gap for you as well until you see your doctor. School attendance, you know how schools work, anyone's here from the ISD, schools get paid by children in classes. That's how they get funded. And so the more times kids are in classes, the better their funding model works. It works that same program as here. So it's Clyde ISD, does most everybody in Clyde ISD within your utility system. Pretty close, depending on where your ETJ is, or if you have an ETJ. And then again, small families, families with children, elderly. This covers up to 10 people per household. So that $9 is up to 10 people in a household. So if grandma's next door, your mother-in-law down the street, it's that household. So it's everybody that's in that system. It also covers up to 10 employees per company. So anybody that's an employer here within your utility system, if they have a meter and they're getting a utility bill, up to 10 people on that utility bill would be covered with this program as well. We are very good at community outreach, so we would welcome the opportunity to come out and speak to everyone, partner with local churches, try to get a town hall, because I know this isn't a decision anyone's gonna make tonight. I certainly respect that. With Crandall, it was a 1.5-year process before we finally put this together. But we did town halls, we talked to our local churches, we did test runs to make sure people understood how it worked. We came to those events that you're talking about and put up a tent. Let me show you how the program works, and did it so people could really see the value of it. And again, it's if you don't want it, don't be a part of the program. But if it does fit for you, this is a great opportunity to have affordable access to health care to bridge all of those gaps for you. And I assure you, if you did that math, that's $108 a year. One trip to a doctor would cost you at least $108, depending on where you go. And it's unlimited. The hours they operate is 7:30 in the morning till 8:30 at night. All holidays, 365 days a year. So I just think it's a wonderful opportunity. The reason I'm here is I have passion about it as a city manager. I saw firsthand what it did in the city of Crandall. And I think that this is a great opportunity, especially for cities that don't have a lot of healthcare facilities at their fingertips. So, any questions?
What's the average copay?
Average copay, depends on what you got. The average copay for telehealth is $40 to $90 on most healthcare. This is no copay at all. This is $9 on your utility bill, whether you use it or not. That's kind of how the program works. And if you don't use it, if you see you're not using it, opt out and get out of the program.
Then there was one thing you had said, so up to 10 people on that utility bill, so you're not registering.
I'm registering the utility bill.
Right, so you're not registering Roger Brown at my utility bill, but my wife is there, if I have children.
I'm registering whosever name is on that utility bill, but all the person would have to say is I'm their cousin, I'm their daughter, I'm their mother-in-law, I'm their grandmother, whatever it is. I'm not gonna challenge any of that.
Okay, gotcha, thank you for that.
Yeah, but it's registered by the owner of the utility bill. So the way all utility systems work, and I'm sure they work the same here, is only the person that's registered on that utility bill can make any decisions on that utility bill. So whoever that person's name on that utility bill, they're the only ones that can opt out, because that's their utility bill. But it's that entire household. And you just get a little number. It'd be a designated number just for Clyde. And so you text that number and away you go. It is that simple. I'd love to do it. I could probably do a test run now, but I don't have that number. I have to do a Crandall number, but I can do a test run with you, and I can show you how it worked. I could get with Dirk and say, give me a few test runs so folks can see how simple this is.
How long has this program been active?
About 3 years. About 3 years. They started with the city of Ferris, Texas. So on the heels of COVID, most cities, most counties, everybody got a pretty good bucket of ARPA funds. And so they had these ARPA funds that were allocated to these different districts and a long laundry list of things you could use them for, and healthcare was one of them. So the city of Ferris is where they started, and the city of Ferris used those ARPA funds to pay for it for those first couple of years. And it since then has rolled over to the utility bills. And they started coming in at East Texas markets. So Henderson, Texas, Crandall, Texas, Maybank, Texas. One of their partners originally is from South Carolina, and so they have a couple of counties in South Carolina they're working with. They are in final negotiations with some large metropolitan cities for the program. Prior to this, there was a similar program that the ER physicians used within that Texas health system, and that was kind of the baby of this, if you will, that caused it to launch over to this.
So, as this grows in popularity, how are y'all planning to keep up with that growth? You know,
He'll just
so-
to keep spanning his network. So it's the physician network. And so these positions of ER physicians networks are huge. So Dirk and his team, they have physicians in New York, South Carolina, New Jersey, Illinois. And so this group of physicians just continues to, you have to be licensed to practice in that particular state. But Dirk tells me that he can put on staff and physicians on demand, because it's just lack of a better word, it's a side gig for them, right? If you have a doctor above the group, a doctor has the right to prescription, but you have PAs and nurse practitioners that can, they have to oversee that percentage of it. They're the ones that are doing a lot of the work. I work with Dirk directly because he was my business partner. He has 7 positions in this group in Dallas, and he says it's very, very simple to get more positions. I'll tell you, it's rather unique, because most people are trying to sell you a healthcare program that's based upon some type of insurance, like an add-on, like an Aflac program or other things like that. That's not what this is. We don't take insurance because Dr. Parrott has seen what insurance is, and he sees the pressure on an ER system that happens just for these types of things. Over 60% of the people that come into the ER, they just need a prescription. That's really all they needed, but they don't have any. If you can't go see your doctor on Friday at 5 o'clock, where are you gonna go when you have fever or or you're hurt or whatever it may be? You're gonna go to an ER or a clinic. Okay?
Okay,
Awesome.
thank you.
Thank you all for the opportunity.
Thank you, Mr. Dean, appreciate that.
You're very welcome. I'm easy to get a hold of, and when the mayor has my contact information, if you want to get hold of me, or there's something I can do, come talk to your citizens, just let me know. Glad to.
You've got his
He
information?
does, and I'll be glad to come back and talk to you one-on-one, or groups, or whatever best fits for you.
Take a major push for informational overload to make people understand that this has nothing to do with the city as far as your utility bill service, so. I think it's a good thing.
I had the same challenge. I was in your shoes. I
Yeah.
know exactly what you're talking about. That's what it took.
That's
It
the
took.
very first thing is, City of Clyde just raised your water rate.
Oh, of course.
That's exactly
Of
what
course,
it says.
or the cities in the healthcare business. Those were my 2 biggest challenges to overcome.
Altogether, it sounds like a very interesting process.
It is a very interesting process. Thank you, Mayor.
Thank you. All right, so we will move on to 8.0, public hearings. 8.1 is notice of public hearing on property located being 213 and 215 Stevens Street, Callahan County, Texas. The request is for replat of 213 and 215 Stevens Street. The property is currently zoned as residential. Public hearing will be held at Clyde City Hall, May 13th, 6 o'clock. Any interested parties may appear at the public hearing to learn more about this case and make your opinions known. Terry, Roger, or this is public hearing, okay, that's correct. Okay. So,
What are they rezoning to, commercial?
What is it?
What are they rezoning to?
no, it's not a rezone, it's
The replat.
replat.
Okay, so they're just trying to combine.
two
We're
lots.
having to replat because the property was not designed correctly for the two houses sitting there. The property sold, and in the process, they figured this out, so now they're having to replat the property and make it work. Both houses get on, where they're actually on their property.
Same owner, right?
Yes. Anybody else have any comments to make during this public hearing? If not, we'll close that public hearing and we'll move to 8.2, another public hearing for notice on property located being lots 3, 4, 5, 6, and 7 of the Lycan Addition, a subdivision of 10.7 acres out of the section 66 BBB and CRR Company, Callahan County, Texas. Request is for a replat of lots 3, 4, 5, 6, and 7 into one lot. Property is currently zoned highway commercial. Public hearing will be held at Clyde City Hall, May 13th, 6 o'clock. Any interested party may appear at the public hearing to learn more about this case and make your opinions known.
This is the final plat on the property over there on I-20.
So is this just so they can combine it into one tax thing instead of 3, 4?
What is it?
Is it just so they can combine it into one property so they don't have to pay 4 different taxes, or?
No, it's not divided right now because the building that is on the property, the bank can't loan on the property because the building touches all the properties. It can't do that. It has to be on one piece of property.
Hmm. How did it end up like that?
They do it to begin with.
I have no idea. That was something that happened a long
It
time
was
ago.
built on there that way.
Seems like, wasn't that the original building was then added to the front section of that, which because of where the original building set, there was basically an easement through there. When they when they added onto the front, that was a whole nother piece of property there, and the person again bought the whole thing.
Right.
So now they connected the building, so it's all one building, but unfortunately now,
They have
it's
to make it
several
all
different,
one lot
yeah.
to sell,
So
right?
they just need to clean it up, make it one lot, that the whole building is sitting on just one lot instead of touching those 4 different plats, so.
That's okay with me.
All right, any other comments during this public hearing? Okay, we'll close that public hearing. That will move us to our regular agenda. 9.1, consider with possible action to approve the final replat on property located being 213 and 215 Stevens Street, Callahan County, Texas. Request is for a replat of 213 and 215 Stevens Street.
I'll make a motion to approve the final replat on the property located at Bing 213 and 215 Stevens Street.
Second it.
Okay, motion by Councilman Mann, second by Councilman White. All those in favor? Okay, passes unanimously. Moves us to 9.2, consider with possible action to approve the final replat on property located at being lots 3, 4, 5, 6, and 7 of the Lycan Addition, a subdivision of 10.7 acres out of section 66 BBB and CRR Company, Callahan County, Texas. Request is for the replat of 3, 4, 5, 6, and 7 into one lot. Any discussion on that?
This is back, what we just talked about, what Mr. Davis had said, this is just cleaning that up, making it one plat for that whole property, for that whole building, sitting on one property.
Yep, I understand a motion for that.
I'll make a motion to approve the final replat on the property located at Bing lots 3, 4, 5, 6, and 7 of the Lycan Addition. Second.
Okay, got a motion by Councilman Mann, second by Councilman Rector. All those in favor? Passes unanimously. 9.3, consider and act upon adopting a resolution of the City Council of Clyde, Texas, contracting with the Clyde Journal for publication of ordinances and other notices as required by applicable law. Mr. Brown?
This is just, last month, we had moved over to the Cross Plains paper simply because of the sale of the Clyde Journal. Subsequently, it was repurchased, and we want to go back to using Clyde Journal as our newspaper of record. So this makes that happen.
Okay. Any discussion on that? Not, I'll entertain a motion for that.
I make a motion that we pass a resolution for the city council to use the Clyde Journal as our public information.
I'll second the motion.
Okay. So we got a motion by Councilman Richter, second by Councilwoman Jolly. All those in favor? Passes unanimously. Moves us to 9.4, consider with possible action approving the updated bylaws of the Clyde EDC. Mr. Brown?
Yes, so there is a copy of the bylaws there in your packet, but for simplicity's sake, the amendment page there is simply what it says. So in the original one, it still lists us our old P.O. box and our old address at a different location from where City Hall is now. So we're just updating our addresses, both physical and P.O. box. It will also EDC board met last week and we wanted to change a couple of the things which allows us to present to council in a better fashion than has been done in the past. So by doing that, we changed some of our dates to November 1st. This puts us right after our fiscal budget year and everything. That way y'all will have everything that's going in there. Change April to November on those couple of things. Again, change February to October. And then what they did with we're 7.04, their checks and drafts, it was set up that they would assume they would have a board member be the person who could sign the checks and everything. What they discussed and talked about was changing it to the officers. So you have a board set up of 7 board members. Inside that board, you will have 4 officers, president, vice president, secretary, and treasurer. And it's only gonna be those 4 that are on the signature cards now. So it will have to be an officer, and there'll have to be 2 officers that sign the checks for anything that happens with EDC funds. This just cleans that up, makes it to where not one person can do it, and not, that it rotates off. Officers are reappointed every year, so this will get assessed every year instead of every 2 years with somebody new coming on the board. So, and that's what that's why we changed that into November, no later than November. That puts us having our meeting for EDC and get all that to y'all at one time, get everything to council at one time. So that's what the changes are.
I was at the EDC meeting, Roger, and y'all were talking about the surety bonds
Yes.
for the officers.
Yes.
Was an amount ever,
Basically 250,000,
250.
yeah. That, which is what it is for our treasurer on that, and what they wanted to do was just make it the same across the board for everybody.
All the
Yeah,
signers.
so all the officers will be assured, a surety bond at 250,000. So.
On the signature card, are we still gonna have the director on there, or is
We
it
will not have a director on the signature card. The director won't have signing privileges at all. It will
Okay.
just be the officers.
Good, okay. All right, any other questions for Mr. Brown or discussion on this? If not, I'll entertain a motion to approve or deny the new bylaws.
I'll make a motion to approve the updated bylaws of the Clyde EDC.
I'll second the motion.
So, got a motion by Councilman Mann, second by Councilwoman Jolly to approve the bylaws. All those in favor? Passes unanimously. Moves us to 9.5, consider with possible action approving the contract extension with Kemper Sports. Brown?
Yes, so last month, Will Spence came up and gave us a presentation breaking down what they've done for us, what Kemper Sports has done, the help that they've given Brady out there at the Hanner Sports Complex. I see we have a rep in the office tonight. We have Mr. Goris here, so thank you, Steve, for being here. And I'm sure he can answer any questions that you may have concerning this. But Mr. Spence did a great job last month explaining everything. This gives us the opportunity to continue the relationship with Kemper Sports, who provides some of the advertising, some of the promotion. They are able to come out and help us if we have any questions or concerns with, say we have citizens that want to have a town hall on something on this, if they want to see what's going on. Kemper's able to help us do that. The biggest thing right now is that they have a meeting with Brady every Monday. They speak to him every Monday. We talk about the tournaments, how we've done it. The biggest thing here is that council knows that when we started the Hanner Sports Complex, the first year or so, that really is going to be a tough time for a business in general, but for the complex, until we establish those tournaments, until we establish everybody coming in, seeing what we have, using that, we kind of sit in a rental agreement kind of thing where we're not getting all the funding that we could eventually. Right now, Kemper's helping us move that over to from a rental type scenario into more of an ownership, which allows us to now move in with Brady being certified and trained as director, tournament director and stuff. That allows us to now quit. We get to the point where we quit splitting the intake on tournament fees and gate fees and stuff like that. And we get to where the city now starts collecting more of that funding ourselves. And this is, Kemper's able to help us out a lot with that, give us some advice. Their company goes back a lot of years, a lot of manpower in there, a lot of people that, through this one contract, we gain the experience of a lot of different divisions and areas that we would not normally have access to. They have graciously decided that they want to continue being partners with us. They are doing good for us. They will not raise their rates on the contract that we currently have with them. They will just like to know that we're going to be partners with them for a while. So what we're asking for is a 3-year contract extension at no increase in fee. So council just needs to decide if they agree to grant this extension.
Any questions for Mr. Brown? Any discussion?
Well, one question I did have,
Yes, sir.
in reading through this, you know, Kemper Sports is suggesting or saying that they'll recommend key performance indicators. So we can keep evaluating and see if we're improving and growing. Obviously, besides the financial end of it, what's gonna measure success with this complex?
Do you mind? Yeah, no, please come up.
Please do.
Thanks for considering this. Well, there's a few things. One is we measure success on how you measure success. So we know the kind of the things that are important to you all, and those would be kind of the first measurables, right? One is financial for sure. We want to increase revenue, keep costs low, and get to a point that the park is self-sustainable. That's ultimately our measure of success. But we also will track things like number of teams that come into town, how many hotel room nights, the economic impact here locally. All those are kind of those metrics that we look at just from a financial picture. But also, just as importantly, is community use, right? We want to track, how many members of our community are using the complex, how are we helping the local organizations grow and prosper, how our internal programs, our camps, our clinics, our leagues that are more used locally, how are those growing? So we're always kind of measuring how we do 1 month to next, 1 year to the next, so that you can see that improvement as we go through.
You mentioned camps. Are those, is that something Kemper helps us organize, or is that something we're to organize
No,
as a community?
One of the things that we've done in this extension is kind of expand our scope of services as well. So we wanted to keep the same fee, but we felt we could help in more areas. Our role is to help organize those. As Mr. Brown said a little bit ago, I think one of the things that happens in these complexes is that we want to start to shift from just having others run programs at your facilities and then just get a little bit of rent to really putting those together yourselves, marketing, and then getting all that registration. It'll always be a balance because we want to support local businesses that want to use that complex to grow them as well. But you've made the investment in the park. We want to make sure you're getting the most back for your investment is our ultimate goal.
Awesome. Appreciate you.
Could you talk a little bit about the marketing and how it's going to bring attention to Clyde?
Yeah, so I'll tell you a little bit of what we've done so far and what we'll continue. Through our first engagement, we redid the website, all the social media channels. We've looked at SEO, which is search engine optimization, so when folks are looking for places to have events, you're starting to pop up. we represent you guys at all of the major trade shows. So we have booths and make appearances at all those booths as part of our agreement. We showcase you to all the rights holders who are looking to have events. Those are important pieces. You'll see some, and we'll share these with you as they go. We'll see some ads that we put in major publications around the country that also promote all the facilities that we help. That's another way. A lot of it is just, most of it comes in from a business perspective. Yes, there's some just general awareness that we get through those, but it's really through our network of relationships. You know, we run tournaments and events in all around the country. And we have those quick dials to the Perfect Games of the World, the NCSs, the PAC Sports, all these big tournament organizations, where we've already built those relationships, and we try to just continue to leverage those to bring you more events, is the goal. So it's a little bit of a mixture of both.
Is there a tool in place to measure feedback from tournament sponsors and
Absolutely.
teams that have?
Yep. Great question. So we do have a proprietary system called True Review. We do that across all of our portfolio that measures feedback on how we are taking care of our customers at each one of our facilities. So that will be instituted here. And that'll be part of our monthly reporting on what type of a feedback we're getting, and more qualitative there, right? Are your bathrooms clean? How's your concessions, food? The biggest complaint we always get is that our umpires are terrible, they don't call the right strikes.
Go figure.
But generally, you know, we crave feedback, right? That's what makes us better ultimately, and we're not timid to get feedback, and how we apply that.
Do we get copies of those comments
Yes, sir.
in your meetings with?
Yeah, we do have a weekly meeting, but we also have a monthly report that comes and all those things, and that along with any kind of financial improvements, other KPIs would be included in that report.
Good, awesome, thank you.
Any other questions?
One final
Sure.
one. You mentioned the monthly reporting. Does that not currently occur, or is that something that's to be started?
No, we do report right now our report goes to Brady every week and then every month on kind of what we've done. It's gonna get a little bit more robust because in our first scope of work, it was really just around sales and marketing, if you review. Now it's getting more into the operations, which is where these quality surveys and things start to come in. Not just before we were really reporting on visits to a website, growth on number of teams, growth in like number of followers on social media platforms and things like that. So it's just expanding that a little bit more robust. And we'd be happy to come and share it with you guys monthly and answer questions. I think certainly would like to engage with you all more often.
Periodically, that would probably be a good idea.
We would love it, yeah. We'd welcome the opportunity.
What's your name?
My name is Steve Goris. I'm the Senior Vice President for Kemper Sports Venues,
How do you spell Goris?
Goris. And I'm only a couple hours away. I live in Mansfield, Texas, so anything happens, I can shoot over really quickly.
They're
We
building
have an
a
office
huge
there.
sports complex out there in Mansfield that you
did.
guys got back in the middle of and kinda got started on all that, so.
Yes, sir.
That's turning into a major facility over there, so.
Yes. We're helping the city out there in a similar situation now.
Yeah, very good.
Thank you, Mr.
Thank you.
Morris.
Thank you, Mr. Gorse. Oh, one other thing on that Steve kind of touched on it, you know, one of the things that we want to do is see that eventually we move into a different kind of market, just instead of softball and baseball out there at the complex. We also want to use that for community things and community events and that. Chief is here right now. We had a meeting last week for our National Night come out. I emailed y'all guys about that. One of the things that we're looking at, now we have more meetings before then, so there's no way that this is set in stone or anything. But that's one of the things we're looking at, is taking that event from the EMS complex where it was last year, which was great, but it was kind of small, into that area out there, into our parking area out there, that front line right there in front of the complex and stuff. So again, one more thing that we, can find a use for our complex out there and, bring foot traffic out there. So anyway, that's just something, that's not set yet. We've got another meeting in June that we're still working details for National Night Out. So anyway, that's all else I had on that.
Any other discussion on this? If not, I'll entertain a motion.
I make a motion that we approve the contract extension with Kemper Sports.
I'll second it.
Okay, got a motion by Councilman Rector, a second by Councilman Mann. All those in favor? That's unanimously. Okay, that will bring us to the 10.0 executive session. We'll convene into closed meeting pursuant to the provisions of Chapter 551 Government Code, Vernon, Texas Code, annotated in accordance with the authority contained in Government Code 551.074, personnel matters concerning the city administrator position. Also, Government Code 551.072, deliberations about real property concerning Fort Phantom water rights in the city of Abilene. With that, we'll end to closed session.